Today I wanted to introduce to you Dr. Ravi, who's part of our gastroenterology team.
As we start getting into the field, you realize that gut health and gut-related cancer prevention, etc., becomes such an important aspect.
Absolutely.
Because many times how we feel physically is at least a portion determined by gut health. About 30% of all body cancers come from the GI tract, so esophagus, stomach, colon, pancreas, etc. The more we can be vigilant, the more we can try to kind of prevent first or to diagnose early. Those would be things that we have to focus on.
We hear so much about the growing concern of colon cancer. And we know that here in Iowa, we've seen upticks in that and across the nation. Can you talk a little bit about the importance of screening, how the screening works? Just give us a little insight to all of that.
Yeah, colon cancer is preventable because a large majority of the colon cancer goes through a polyp stage. You can think of them as like small mushroom type growths.
Okay.
And over a period of time, they can become cancer. So if you nip them at that level, you prevented the cancer progression.
Okay. So that's why the screening is so
That's
important.
why screening is important. The best screening test seems to be colonoscopy because both in terms of finding polyps as well as finding cancer. There are other options such as a Cologuard, which is a stool test.
Okay.
That's second best because it's good at picking up cancer, but not so good at picking up polyps.
The best is the
Colonoscopy aspect of it.
If you want to do a little less option, but you should do something, obviously with the rates, you could do the Cologuard as next best.
A diet that's more plant-based and less red meat-based, exercise and staying at a lean weight, moderating alcohol, all of these seem to help with some of the gut cancers.
I love how we've been able to work together, even though we have some miles between us, not too many miles. And so it's been just such a great partnership between you and your team and our team here in Fort Dodge, where we feel like now we're one team.
It's been a pleasure coming here. Everybody makes us feel so welcome. I also appreciate the patients that I've interacted with in the last couple of years. They're also appreciative. Most important, I think, is the relationships and the depth of affection that we share with our patients. I think that keeps us going. And to me, that is an important aspect of what I think I feel in your institution here. So I'm glad to be here.
You talk about mentors, but you've been such a big influence in mentoring our team, and we sure do appreciate that.
Jess Bailey and Kendra Ulicky have been so excellent in providing care to the patients.
Yes.
They have been working with our team in trying to discuss in a collaborative way if there is any nuances, any support that's there.
I appreciate how much you care about the people of Fort Dodge, and you've been willing to work alongside of us over these last 3 to 4 years. It's just been such a joy to work alongside of you. Thank you so much for joining us today, and thank you for listening to our videos today.